Hello, I'm Adrienne Brigitto, Director of Nurse Education for Springer Publishing Company. Thank you for joining us today for a webinar on redesigning health assessment. The webinar will be presented by Karen Myrick and Lima Korosis, editors of the new textbook, Advanced Health Assessment and Differential Diagnosis, Essentials for Clinical Practice. At the end of this webinar, you'll receive a survey in which you'll have the option to request a desk copy of their new textbook, which we certainly hope you will do. Karen Myrick is Coordinator of Interdisciplinary Research at the School of Interdisciplinary Health and Science, Department of Nursing at the University of St. Joseph in Connecticut. She is also Clinical Associate Professor of Medical Sciences in the Frank Netter School of Medicine at Quinnipiac University and maintains a clinical practice as a nurse practitioner. She has many years' experience teaching health assessment and as a researcher with a focus on athletes and sports medicine. In this capacity, she works to improve clinical health assessment of this patient population and developed and tested a newly designed physical examination technique for determining hip labral tears. It's called the Hip Internal Rotation with Distraction Test. She is a prior recipient of the National Organization of Nurse Practitioner Faculty's Outstanding Researcher of the Year Award, a prolific author of articles, books, and book chapters, and a senior editor for the Interprofessional Journal of Clinical Case Reports. She's joined by Lima Korosis, a clinical professor of nursing, chair of graduate nursing programs, and director of online nursing programs at Quinnipiac University in Connecticut. Dr. Korosis has been a nurse educator for more than 20 years and a practicing nurse practitioner for more than 25 years. She has experience in direct patient care, urgent care, nursing homes and assisted living, and international healthcare clinics. Dr. Korosis has a keen interest in non-traditional roles for advanced practice nurses, in addition to maintaining their clinical expertise, and she promotes creativity and entrepreneurship. She is a proponent of interprofessional healthcare delivery, as well as interprofessional research to improve the effectiveness and efficacy of the healthcare system. Dr. Korosis has collaborated with nurses internationally and has published journal articles on nursing history, spiritual care, and mentorship. She's authored book chapters on physical assessment techniques and cultural health assessment, served as a member of the International Editorial Advisory and Review Board for Nursing Education, Research, and Practice, and is a fellow of the American Association of Nurse Practitioners. We will try to address any questions you have at the end of the presentation, so please do feel free to submit the questions throughout through the feature on Zoom. Without further ado, I will turn the presentation over to Dr. Myrick.
Hi everyone, thank you so much for joining us. I think probably one of the biggest questions that people have is actually why redesign health assessment? We really stopped and thought a lot about health assessment as we came upon some of our pedagogical issues. And one of the things that we thought is about traditional health assessment and as nurses, nurse practitioners, physician assistants, as clinicians, how we approach that patient. In traditional health assessment, we teach by body systems. We often combine the normal and the abnormal together, which sometimes makes it really difficult for our patients, for us to be able to figure out what's happening, for the clinician to be able to diagnose correctly, for the students certainly to learn. It's very confusing for them to try to lump this all together. Another thing we really thought about is how special populations are addressed in a traditional health assessment text and class. And one of the things we notice is that there's all of the special populations, such as the disabled patient, the elderly, the pediatric patient, the pregnant patient, and they're all put into a separate chapter. In that separate chapter, we try to address all the body systems and what's happening with that patient. What we thought should happen is to probably have them in each body system and address those special populations as they are individuals. We also noticed that in most traditional health assessment textbooks, that holistic assessment is actually very much a missing piece. So clinicians, right? So we want our students to become excellent clinicians. And as clinicians, we want a textbook that we're able to refer back to, which we commonly do in practice, and find a certain thing. In this textbook, one of the benefits is that we have a very systematic approach to physically assessing patients. We also are including this holistic assessment, which we're going to talk about in detail in a couple of minutes. And this helps to guide both diagnosis and treatment plans as well, usually arriving to a faster diagnosis and then a more accurate treatment plan. The benefits to patients are that certainly if we have well-honed skills in both history taking and physical examination, this is going to be very foundational to getting an accurate diagnosis and moving on to appropriate care and treatment. Also, accurate diagnosis is going to result in efficient and effective, cost-effective care, which in this day and age in the complex healthcare environment is a very big result. So to the professors, what is one of the benefits to teaching in this redesigned approach? Well, we feel like there are many, and we're hoping that people find that to be true. Students will definitely learn how to approach physical assessment, considering the social determinants of health. Also, it'll help facilitate student learning by providing information about clinically relevant techniques and normal examination findings first. It's sometimes very difficult to figure out what is abnormal until you know what's normal. And then being able to move on to identify abnormal findings that would require a more in-depth assessment technique. We also feel like instruction that integrates these special populations will very much teach students to be inclusive, to treat these patients, they are a special population, but yet they're patients, and to make them more holistically approached and to be able to identify these differences and compare and contrast between these special populations. We have a lot of case studies, which are a great way for us to teach and for students to learn, that are included to help reinforce learning. There's also a PowerPoint and test banks as well for each chapter, and this is really going to help to ease adoption. Going from the normal. So what we do in this textbook is to approach the health assessment from teaching the normals first. So what is normal for the skin assessment? What are normal findings? And being able to then understand those normal findings and develop an appreciation and recognize what is abnormal and what needs either that focused review, the patient to come back, whatever the case might be. We also know that there's two different types of visits. There's a well visit for patients, and there's also a patient complaint that'll come in saying she has or he has itching or has a headache, and then how do we then discern between those two? They're very different appointments. This will help the patients in the clinical setting, not only while they're in school, but afterwards as clinicians. So there's a comprehensive screening exam or well visit, and that's a very frequent patient encounter, especially that clinicians, nurse practitioners, PAs need to be prepared for and prepared well for. It's also very difficult for them to figure out what's abnormal, what do I need to delve in deeper, what do I need to refer to a specialist for if I don't have a solid foundation of what's normal. It's one of the reasons that we approached it in this way. So an example, a routine screening exam, probably we'll do the head to toe and we'll do a whisper test for gross hearing. Now, if that comes back normal, great. If that doesn't come back normal, this is where students and clinicians alike say, well, what's the next step? It's not always refer out to an audiologist. What else can I do as the clinician that will help me arrive at the appropriate diagnoses? So we might do the whisper test for a gross screening hearing test, while a focused exam for a patient with a complaint of hearing loss or something identified with that whisper test would go on to include a Weber and Rene test. Also, perhaps that routine screening exam, we go through our range of motion, patient looks great. No, this one doesn't. So what's different about this one patient? That's going to prompt the clinician to perform several special tests. And those tests would be, individual for each joint. Those are something that we go through in this textbook, identifying what's normal, and then what do I do with the abnormal? So a routine screening exam, range of motion, external rotation is only 20. Well, we know that that's not normal. It should be 30, 35. So that's actively, so it prompts that clinician to do more. Perform a Hawkins and Near test, in addition to passive range of motion that might be able to make the definition and define frozen shoulder. So in order to be able to understand the normal, at the abnormal, we start with the normal. Really a different focus.
Thank you all for listening in today. This is Lima Carosis, and I'm going to continue with the holistic assessment. We have to remember that assessment in general is very complex. It's not just looking at a body part. And we need to remember that the patient has many factors that will influence how they're feeling, what they tell you that day or don't tell you. So it's not just completing a physical exam, it's really looking at the relationships that the patient has between yourself and the patient as the provider, between the patient and others, between the patient and the world around them. So when we're doing our health assessment, we're really looking beyond the physical, what we can see right in front of us, and discussing things that may in the beginning not seem relevant at first. So we want to include all the areas that will affect a person, the environment, not just work and not just home. We want to look at the stress that they have in their lives. Right now, with all of the information about the coronavirus, that tends to be very stressful for all of us in trying to figure out how our lives and our jobs and everything are going to change as a result. So that's just one example of the type of stress that everybody is actually going through right now. How does that impact our life balance? This is true for everybody that we see in our clinical practice as well. We talk about relationships, and we do that very often with our patients. But a lot of times we don't get beyond who do we live with, who's our support system. So we need to look a little bit more in depth about the relationships. And we need to remember that everybody is looking for balance. They're looking for balance between their work life and their home life. They're looking for how to be able to have a good life with their families, as well as whatever they do outside of their employment. Other factors that come in here: nutrition, exercise. I'm sure all of us have heard from our patients, I don't have time to do that, or I don't have time to cook, or I don't have time to exercise. What we want to imbue into our students is that these are things from the very first encounter with our patients we have to start asking about. We have to consider the whole person every single time with every system and every issue. So holistic assessment is actually integrated into every single body system. So in traditional assessment, we're looking to make a final diagnosis. We're looking at the body systems. We're usually looking at cognitive function. The goal is to determine the differential diagnosis and then to decide what further diagnostic testing we need, all in the hopes of getting that final diagnosis. Holistic assessment is much broader than that. Of course, we have to figure out what's wrong with the patient, but we need to look at what's important to our patients, how they see themselves in their world, and how this illness or their wellness, how they keep themselves well, and what are all the factors involved in that. So if we can imbue this very early in our students' education and help them realize it isn't just the person with pancreatitis, that's not the only focus. We need the larger focus on the patient. So our goal is not only to determine that diagnosis, but what's actually going to help the patient, what they find is important, and how they interact with everything in their environment, their work, their home. So this interaction, extremely important. They have a lot of different factors. Every patient has a lot of different things that go into all the different interactions that they have. Usually we start talking about family, friends, their work colleagues. What's their environmental conditions? What things will have an impact on their health? How much stress are they under? What I've found over the years, and specifically the last few years, is that there's a lot more people that are either willing to admit they might have symptoms of depression and anxiety, or they are developing more symptoms of depression and anxiety. Again, using coronavirus, that's right out there. Every day, people are tuning into what's the latest information, and is this something that I need to worry about? Well, they are worrying about it. Those local and global events make a huge difference to all of us in how we perceive the world and how we feel about it. So it is, again, important to have this all integrated from the very moment they start health assessment. So examples, things that lead to physical and mental illness. We know that stress in the job or home will lead to physical and or mental illness. There's financial difficulties, there's strained relationships, there's fear of violence or harassment. Right now there's fear of, becoming sick. Lack of a healthy lifestyle, that person that feels that they just don't have time to take care of themselves. The global events that occur, terrorism, the lack of security, the pandemics that occur in the world. So we need to consider that whole person in order to help them live a healthier lifestyle from the moment that we meet them in our offices. We need to consider all the other things that are going to impact their mental and physical health. Again, it's included in every system, every issue, every time we talk to the patient, and our goal is to lead to better management and health coaching for the patient so they can live a better life. And that's what our entire, I'd say, practice is about, helping our patients recover from illness and lead the healthiest lives that they can.
Excellent. And that holistic assessment leads us also into the assessment of special populations. As I noted in the beginning, is pretty typically in traditional health assessment texts is we will lump these patients into one group instead of multiple groups, and we'll put them at the end or the beginning in a specific chapter called special populations or other. And what we did and what we feel is that it's really important to assess these patients within the body system. So they are a special population, but what is so different in the pregnant patient's GI system, in the veteran's musculoskeletal system? What is different in the pediatric patient for cardiology? Also with the elderly and the transgendered population. Something that we were really blessed to have is we had an expert. We had Suzanne Smeltzer from Villanova, and she was our expert consultant for every chapter on every section where we talked about patients with disabilities. This enabled us to be able to see those differences in the evaluation of patients in each body system and what we needed to consider for that patient with disabilities. For example, when we talk about the patient's vision, we talk about their hearing. So when we did the eye and ear chapter, we talk about for patients with disabilities to be able to have optimal hearing, to be able to compensate for limitations in their physical ability. We also talk about there's a baseline for assessing musculoskeletal function for the patient in order to be able to then understand what for that disabled patient needs to happen for them to be able to do their work, to live their life, to be mobile, to be a productive member of society. So what accommodations can we assist them with in order to have their needs in place for them? Within each body system, we talk about the pregnant patient. So when we come to the pregnant patient, what is normal for that patient? What is abnormal for that patient within each and every system? So skin. There are skin changes in that pregnant patient that are normal. There are things that are abnormal. So within each system, we discuss the pregnant patient and the differentiation between this patient, the pregnant patient, and all the other special populations as well. And this needs to be considered within each body system in order to be a really effective clinician. We also talk about, for example, if the pregnant patient, there's lots of patients that come in with low back pain. In a pregnant patient, this might be considered a normal finding, depending upon where she is gestationally and the hormone relaxin being released and also the gravid abdomen. So maybe this is something for the pregnant patient that's considered normal. So this special population discussed right there in musculoskeletal with that condition in mind is something that is really beneficial to think of while we're teaching our students and also as a clinician when we're in practice. Another special population that is addressed within each body system is the pediatric patient. So across the lifespan, when we talk about assessing patients and what might be different in that pediatric patient for respiratory, and where is that special population fit into the assessment. So this considers a pediatric population right there with the adult cohort and then differentiates what we might find in that body system for that pediatric patient. A good example is in the musculoskeletal system, we must consider the physes, right? The growth plates in that special population because it needs different attention than somebody who is skeletally mature. And these are clearly illustrated throughout the text. It'll help us in our teaching, it'll help us in our patient care. We often find completely separate chapters or even separate textbooks for geriatric or older patient. But the physician assistant population, the nurse practitioner population, whether they're adult, gero, or family, needs to consider this geriatric population because they're going to be assessing patients across the lifespan. There are age-related changes that are considered normal and those that are considered abnormal, and these are illustrated within the context of the body system. A good example is changes in renal function. You may have a geriatric patient with a different GFR than your patient who is, not geriatric, so they're either adult or pediatric, and you'll be able to see that very clearly. There's also changes in the gestational tract that are discussed along with the other age groups. Very helpful to consider them together. A special population that is not only grouped together, if it is at all considered in other textbooks, is the veteran patient. So what we've done here is really taken that patient in to be considered with every health assessment. It's important to understand what might be specific to that veteran's health assessment, to their experience, to where they served, if they served, if they're in active duty. What in that patient considers the considerations what they might be. So what we do is we took in each chapter and looked at the veteran patient within each body system and just made the considerations for, did they serve? Where did they serve? Did they have specific exposures? An unfortunate but good example might be that in the head and neck assessment, this patient may have lymphadenopathy. This may be more likely related to a lymphoma than another patient who might have an upper respiratory tract infection. There may be exposure to certain agents, such as the link between Agent Orange and the association of non-Hodgkin's lymphoma. So the veteran patient is very much a special population that is considered within each and every body system throughout the text. Also, the transgendered patient. This special population is occasionally brought up in other traditional textbooks and taught as an add-on occasionally to our students, but something that we really need to do to be all-inclusive as a provider is to really consider this population within our health assessment. And just to mention, health assessment is a very big component of the certification examinations. It's a very large piece. When we do consider these special populations, it allows us to be better versed in being able to care for all types of patients, all different special populations and normal patients as well. Clinicians really need to be prepared to take care of everybody. And noting these considerations within each body system allows for them to be able to compare and contrast, what is different in each one of these special populations. A good example here is considering performing a prostate-specific antigen or a PSA test on a transgendered female.
And one of the final sections in each chapter is the section on diagnostic reasoning. So each section contains steps for diagnostic reasoning. We eventually want to use the health assessment, the physical exam, the history, the review of systems, the holistic assessment to reach some sort of conclusions or to understand what the next step is going to be if we can't reach a conclusion yet. So we need to lead students to understand what are the differential diagnoses, what are the possibilities for a person who's complaining about these types of symptoms, and does that align with what the physical findings are and what is most likely going to be the underlying cause. What's the evidence for each differential, and are all the possibilities included? We don't want to come to a premature conclusion. We may be missing things. Our holistic assessment helps us broaden our perspective to understand what's really going on. I'm sure all of us know patients who may put together two things that aren't really cause and effect. So we want to make sure that we look at every symptom, every finding, individually and as a clustered group to see what types of differentials need to be included for this patient. What's most likely? What could be life-threatening? What should we not miss because it could be fatal for the patient? So all of these things are included toward the end of each chapter. So the diagnostic reasoning process helps that novice practitioner to develop those critical thinking skills, to be a detective, to put these steps together, to figure out, okay, what are the next steps that I have to do to be able to figure out what's really happening with this patient so I can help them. So very seldom do we actually have a miracle that happens. It is us putting together that information that's leading to the appropriate next steps. An example of this is when you look at headaches. There's many different kinds of headaches. There's migraines, there's tension headaches, there's cluster headaches. How do we differentiate between them? Well, we can take a look at what are the common factors that we find with migraines or tension headaches. And are these the symptoms and the findings that we are eliciting from the patient? So that way we can say, okay, it looks like migraine. The other big thing to understand with diagnostic reasoning is sometimes people don't have one problem occurring. They can have several problems occurring at the same time. So maybe there are features of both, and maybe they are having a tension headache and a migraine. That is possible as well. But then being able to put that evidence together in a way that makes sense, and also to make a case for why we think this is happening. If we can't do that, we really can't get on to the next step, and we can't get to the point at which we can discuss interventions with our patients to help them feel better. The students learn that the final diagnosis is really based on our evidence. It's based on all the information that we have elicited from the patient. Generally, we don't come to a conclusion right away. Often we do need further testing. And as I mentioned before, in the case of headaches, that may include more than one issue when we're talking with the patient. The holistic assessment, therefore, must include all of the possibilities. It can't prematurely come to a conclusion when we haven't really done all of the work to get there yet. I have had in my academic practice students that either don't want to at all exclude any differentials because they want to include everything. So you have to teach them how to slowly exclude certain parts or certain things that it can't be. At the same time, there are other students that say, well, that's what they have. And I'm sure many people have encountered that when they haven't really thought about the broader evidence for other conditions that could be present as well. So diagnostic reasoning is included in every chapter in order to help our students figure out how to put the evidence together and what makes sense for each one of the differentials that need to be considered. And I think at this point, we can open this up to questions.
Yes, thank you very much, Karen and Lima, for this presentation. It's very interesting. And I do have some questions for you in regard to the diagnostic reasoning and really the piece of putting it all together. And can you talk a bit about your approach in the book? You've used very unique tables to review differential diagnoses for each condition. Can you talk through your approach and how you think it's helpful to the student and instructor?
Sure. Our tables really go through symptoms, and they cluster symptoms according to what are the most likely diagnoses or differentials for that grouping of symptoms, excuse me. So if you're looking at somebody who has a unilateral headache that's severe, they might see flashing lights before that. I'm talking about the migraine side before this. So those types of symptoms are most likely going to be migraine. And it helps the student then look at, oh yes, okay, so all of these things go together. It also provides a way to look down a table and say, wow, 4 out of these 8 differentials have very similar symptoms. So what are those symptoms that are going to make a difference between one diagnosis and the other? How do we differentiate when they're very similar in the cluster of symptoms that we're having? If we take a look at the common cold and the flu, there's a lot of similar symptoms. People can have a runny nose, people can have a bit of a cough, but there are certain things that make it different. It's beyond a cold when you have a high fever. So you start differentiating depending on what extra symptoms that they have and what other things you can uncover. So I think the tables help because they put the information in an organized way so that students can take a look at, okay, if I have a patient with all these symptoms or some of these symptoms, these are the kind of things I should be thinking about. And they also then need to think about, okay, if the big difference between this is how high their fever is, well, maybe that's something that I need to look for. What else? What other questions do I really need to ask? And I'm certainly not done yet because I can't get to that diagnosis yet. There's only things I can consider, and I have more questions to ask.
That's great. Thank you, Lima. We received a question from the audience from Lynn Benke. She's being asked to decrease the time from 16 weeks to a 7-week course for physical assessment. Keep the 3 credits and compress the course or break into a 2-credit 7-week course for physical assessment and then another 7-week course for critical thinking. Would this book help me with this? And what are your thoughts on it?
Well, that's interesting because we have an online 7-week course in a program that I teach in that teaches health assessment. And I think it is something that can be done. I think you could go about this in different ways. The critical thinking portion is at the end of each chapter. So certainly you can start with the beginning of each chapter and go through. I think the hardest part, and I think what students tend to focus on, is the skill. How do I do this? I think it's harder to lead them to, okay, what does it mean? So what you're talking about, if you have a 2-credit 7-week course for physical assessment, another 7-week course for critical thinking, is let's learn the skill and what the abnormals and normals are, and then let's use the next 7 weeks to figure out what it all means. So I think it is doable, and I do think our book will help with that because we have sections that are specifically diagnostic reasoning. So I think that helps the students understand this is what you're learning and why you're learning this, so you can differentiate between what's normal and abnormal, that you can make that holistic assessment. And now we're going to move on to how do we use that information, because truly that's what diagnostic reasoning is.
Right. I was going to say, thank you so much for the question. And I do think that this would help you, especially because students will learn a little bit faster, I believe, if they learn those normals first. I think it'll foster their critical thinking skills in order for them to then be able to, kind of get through the normal. And if this is an APRN program that you're talking about, they do learn health assessment undergrad, so they'll have some skills there that they can build upon. And then learning or reinforcing what they know as normal, you can then go into the abnormals, and I think that it'll be a lot easier to be able to do that in a 7-week program.
Great, thank you. And could you also talk a little bit about how this book could be integrated into the course? You mentioned briefly some of the instructor resources, but could you speak a little bit more in depth about those?
I'd be happy to take that first, Lima, if you'd like to chime in after. So we have an instructor manual that is really beneficial in kind of teaching the teacher how to use the textbook and how to be able to teach with that textbook. Also in that instructor manual are additional case studies beyond what's in the textbook, so that the instructor might use those to build upon that information. We also have a very good test bank with multiple questions for each chapter that are already there for you to be able to use, to just kind of plug right into whatever exam system you're using. And there's also instructor PowerPoints that get to those key points of what's important for the students to know, to learn, and what it is important for the instructor to be able to put forth.
Great, thank you very much. So we also have another question from the audience. Sandra Cotton is wondering, how does the book address current daily practice, less time per visit with patients? Although we want students to be more in depth with assessments, how do you balance that? And how is it addressed in the book?
So I can start, Karen, if that's all right with you. So I do think that going from normal to abnormal, students are more readily able to address what is an abnormal finding. I do think adding a holistic assessment, they're able to pick out the issues a little more quickly. Both of us are practicing clinicians. We know the time crunch out there. So we want students to be very skilled at health assessment before they go out to see patients. They are also under a time crunch because the preceptors they're working with are going to be under a time crunch. And they don't have the ability to teach as much and spend as much time with the students. So our goal in writing this book was to increase the proficiency of the students, increase their understanding of what health assessment is. And I think when they are more efficient and effective in obtaining the answers and the evidence, that makes them more efficient in the clinical arena. yes, we do need to get the answers. We do need to get down to interventions, and sometimes I just heard from a colleague of mine that their acute visits are now 10 minutes each. So I do understand that time crunch, but our goal then in teaching our students is to make them more proficient and efficient, and that these things come to them as second nature. They don't have to think about it anymore. They understand what kind of factors go into assessing a person's health and what kind of things they need to look for on exam.
That's excellent. And also, preparation for practice is probably one of the main reasons that we actually decided to redesign health assessment, because the traditional method for teaching health assessment we didn't feel was appropriately getting that student ready for clinical practice. A few reasons for that is sometimes we have textbooks that have been around for a while, and not necessarily is everything in there evidence-based. It's just because we've done it that way, we continue to. I'm just going to give you an example, which is listening to vowel sounds. So in the textbook, we go through, you want to listen to vowel sounds. You don't necessarily need to listen for, 5 minutes in 4 quadrants, but what is the evidence-based health assessment? Why do we do what we do? And also, the differential diagnoses table will help the student to prepare. There's certain things that are pathognomonic. So you hear, right lower quadrant pain, and we start to think about the appendix. We hear about certain things in every different system, and we start to think about the diagnoses. So we're trying to help by using that differential table to get those critical thinking skills to be faster and to prepare them for, 10 minutes is a quick visit, but for maybe 15 or even shorter. Every patient needs are different. So by the textbook also using those special populations addressed right there within, we feel that will prepare the student for clinical practice, better and faster. So they're not looking up, oh my goodness, now I have this patient that's in this special population, what do I do?
Great, thank you. Could you also address the multidisciplinary nature of the book? How we've had some questions. Is this appropriate just for the nursing market and nursing courses? Where is this relevant? How is this text relevant to multiple markets?
I'll start this one. 2 things I thought about. One, just in addition to that last question, is also the case studies in this textbook include the ICD codes, 10. So, before we change to 11, but we do have that to help them prepare as well for practice. And then the interdisciplinary nature, this is a very appropriate textbook for clinicians. So people out seeing patients. So MD, DO, PA, NP, and the authors, if you notice, from each different body system are experts in their field. There are PA authors, there are authors that are APRN authors, and we kind of really went across the United States and included a lot of different people because of their expertise in health assessment and in those specific areas.
I agree, Karen. I was going to mention the same thing, that we have PA authors, NP authors, all different kinds of authors, because it's really about health assessment and how to learn how to assess patients well. And a lot of us, there's many professions who do that. So it's not limited to simply nurses and advanced practice nurses.
Great, thank you. So we don't have any further questions from the audience. I'm wondering if there's anything else you'd like to share about the textbook, or anything oh, actually, we do have one further question. Is this textbook good for reviewing for the NP certification exam?
I'm going to take that because I know on the NP certification exam, there are a lot of questions that depend on your assessment skills. One of the things I say to my students is go back to your assessment book. You need to know those skills, and you need to understand how to put those symptoms together to come up with that diagnosis. So yes, absolutely. I think this is a very good resource for studying for the boards. If you don't know how to put those, if the diagnostic reasoning portion is not up to snuff, the students will not pass that exam. They really have to know their underlying assessment well.
Yeah, that's excellent. I would also agree with that as well. And just say that, because this was just, it's new. This is a new textbook, and so we have really incorporated everything that is up to date and current. And by the time somebody is taking that certification exam, this should be a really timely resource in order to get accurate information from.
Great, thank you very much. Is there anything else you'd like to address, Lima and Karen, before we conclude today?
I don't think so. I appreciate everybody's time and attention, and really do welcome any further questions that anybody might have.
I agree, and you're certainly welcome to contact us. I think I like the way the different sections of each chapter come together to help the students really understand health assessment, and how everything that they do is going to be based on how well they assess their patient.
Perfect. And we have a question. Who has the 7-week course, and can I contact you? That would be you, Lima?
That's me, yes.
Mm-hmm. And we can certainly we can share that information with with that attendee. Absolutely.
Absolutely. Yep.
And I would like to thank everybody for joining us today. As I noted at the beginning of the webinar, we do have a survey that you'll receive, and as a part of that, you'll be able to request a desk copy of the text so you can spend some time looking at all of the different features and looking at the instructor materials. So thank you again, Lima, Karen, and thank you to everyone for joining us today. Have a great day.
Thank you.
Thank you.